Dr. Lakshmileela. I'm a consultant pediatrician at Rainbow Children's Hospital, Hebbal, Bangalore. I'm here today to discuss the screen time recommendations for children. Before we understand that, let us know what do you mean by screen time. Screen time is the total time spent by the child in viewing the screen in a day. The screens can be mobile phone, tablet, television, laptop, anything. So if the screen time is used for any educational or social activities, it is called as healthy screen time or positive screen time. If the screen is used for viewing inappropriate TV channels or playing violent video games, it is called as negative screen time or unhealthy screen time. So what are the time frame for different age groups? Children less than 2 years should not be exposed to any screens. Children between 2 to 5 years, the recommended time is 1 hour. And lesser the time spent on screen, it is always better. In older children and adolescents, the screen time is always balanced with the other activities which are important for their development, like 1 hour of physical activity, time for their school activities, time for the hobbies, time for the meal time, and then family time, etc. If any of these activities are getting compromised because of the screen use, this is called as excessive screen time. So are there any ill effects of excessive screen time? Definitely excess of screen time going to affect the physical, mental and social health of the children. Physically, they can have a sedentary lifestyle. Because of that, obesity and its complications. It is also seen that children can develop frequent headaches and then disturbed sleep in their lifetime. What are the ill effects of excessive screen time? Definitely the excess of screen time is going to affect the physical, mental and social health of the children. Physically, they can have sedentary lifestyle, obesity and its complications. Children also can have frequent headaches and disturbed sleep. It is also seen the children using excess of screen time can have eye strain, back pain, wrist pain, etc. And children with these kind of habits also can have delayed speech development, hyperactivity, poor concentration. They also can have desire of instant gratification, fear of missing out things. They also can have reduced social interaction, social anxiety. Because of excess screen use, the academic performance definitely comes down. So are there any benefits of use of digital devices? When the devices are used in moderation, in a balanced and a healthy way, screen time definitely can be utilized as a positive boon in the children's life. It encourages learning and improves the knowledge in the children. Platforms like blogging platforms, YouTube channels gives opportunity for the children to display their talents. And then Kindle devices improves the reading habits in the children. What are the right age when we can introduce the digital devices in children? Less than 2 years, no devices are encouraged. At 2 years, we can introduce television and computers, but along with the child, the parent has to view the screen, and it is preferred to have educational and interactive videos of short duration. Older children and adolescents, an ordinary mobile phone is what is recommended to be given to the children. This is mainly to maintain contact whenever they are going outside. Older children and adolescents also can be given smartphone for the purpose of scholastic performances or other recreational activities. Here the parental supervision is always required. What are the minimum permissible age for the use of different social media platforms? Platforms like Facebook, Twitter and Instagram can be used by the children who are 13 years or older. YouTube can be viewed by children of 18 years and older, and WhatsApp can be used by the children who are 16 years and older. Children between 13 to 18 years can use these platforms only with the parental permission and with their supervision also. Before we allow our children to use these platforms, we should make ourselves familiarize with the platforms and understand, is it safe for the child, is it right for your child, and also teach your child the safety rules of online interactions. So is there an entity called media addiction in children? Unhealthy use of the media can lead on to media addiction. Online internet gaming addiction is a psychological disorder in children. Whenever you see your child compulsively uses the screen, craves for it, has lost the control of its usage, and the child gets violent whenever we ask to stop its use, and a child has been seen to continue to use the media in spite of consequences like a fall in academic performance or loss of friendship, then you see that your child has been addicted to the media. Whenever you see either of these red flag signs, you should definitely meet the pediatrician or the psychologist at the early. Before we introduce our children to the screen, let us understand these recommendations and then help the child to use the screen in a positive and a healthy way.